Today, we're going to talk about a very commonly prescribed medication called amlodipine. Whether you're new to this medication or someone you love is new to this medication, or you're simply just wanting to know more about this medication, I've got you covered. So today we're going to talk about how amlodipine works in the body, common side effects that we should be on the lookout for, what to do if any of these side effects happen to you, what to do if they don't go away, and lastly, we're going to talk about why your doctor would even give you a medication that has potential side effects. Amlodipine is a medication that's commonly used to treat high blood pressure and chest pain, also called angina. Amlodipine also goes by the name Norvasc, and it's in a class of medications called calcium channel blockers. And this class name simply describes how the medication works in the body. As the class name indicates, it works by blocking the calcium channels. If you think of your blood vessels like a water hose, when you turn on the water hose, the water runs through the hose at a certain pressure. Now, if you imagine if that water hose was stiff and narrow, the pressure would be higher, right? That's very similar to what happens to our blood vessels when we have high blood pressure. Amlodipine helps to widen and relax the blood vessels, making it easier for the blood to flow through the blood vessels, reducing the overall pressure. Amlodipine works extremely well to lower the blood pressure, which helps to prevent against strokes, heart attack, and kidney problems. Like all medications, amlodipine can have side effects. If you Google amlodipine, for example, or any medication for that matter, a long list of side effects are going to pop up, and it's probably going to scare you. And this is because drug companies are required to list every single reported side effect that its customers report. And in many cases, a lot of these side effects don't necessarily have anything to do with the medication itself. With every medication, there's usually 2 or 3 side effects associated with the medication that your doctor will be on the lookout for. The most common side effect with this medication or with any medication is the result of how the medication works. So now we're going to break down some of the common side effects based on how it works. The first most common side effect is swelling of the feet and the ankles. Based on how the medication works, when the blood vessels widen or expand, a small amount of fluid can sometimes leak out into the tissues of your lower legs, which causes swelling. Another common side effect based on how the medication works is flushing or warmth in the face. The widening or the relaxation of your blood vessels can increase blood flow to the skin. And because blood is warm, you often feel a warm or a flushed feeling. Another potential side effect based on how the medication works is dizziness and lightheadedness. As your blood vessels widen and relax, it causes your blood pressure to lower or decrease. And so as your body adjusts to this new medication, sometimes you can feel dizziness or lightheadedness, especially if you stand up too quickly. While these side effects can be annoying and bothersome, the good news is, in most cases, they're temporary and mild, and often these side effects will go away as your body adjusts to the medication. Understanding why these side effects occur can help us manage them better. So there's a few things that we can do to help either minimize or prevent some of these side effects from occurring. First, we want to stay as hydrated as possible. Drinking plenty of water is going to help decrease or prevent that flushing that we may experience, or that feeling dizzy or lightheaded, or our swelling in our legs. In order to prevent that, you want to really stay active. So you want to avoid sitting too long or standing too long. If you experience swelling in your feet or your ankles, you want to try to elevate your legs above your heart as much as you can. So if you're at home and you're sitting, or you're in the office and you can use a footstool, it's always better to elevate your legs. Secondly, you want to move your body. So you want to avoid sitting too long or standing too long, because moving around is going to help improve our circulation. It's going to help move that fluid back upwards to our heart. And lastly, you want to try to avoid alcohol. So alcohol can sometimes exacerbate these side effects. So you either want to limit or just avoid altogether. And as always, if you experience any of these side effects, you always want to talk to your doctor and let them know. Because in the instance that your side effects or your symptoms don't go away, or they are affecting your quality of life, or they are affecting you to the point where you don't want to take the medication anymore, there are other options. Because most of these side effects are what we call dose dependent, which simply means the higher the dose, the higher the chance of getting side effects. What your doctor may do is decrease the dose or adjust the dose to prevent some of these side effects from occurring, or they may just completely change the medication altogether. Then the question is, and a question that I get often is, why would your doctor put you on a medication that potentially has side effects? And the answer is every single medication has side effects. In fact, everything that you put inside your body has a potential side effect or risk. And this includes herbs, this includes supplements. The key is to weigh the risk and the benefits of everything that you're intaking. For instance, the risk of taking amlodipine could potentially be swelling of the feet and the ankles or some flushing. However, the potential risk of not taking the medication and continuing with your blood pressure at 160/96 would be kidney failure, heart attack, and stroke. So my number one goal, and many primary care doctors' primary goal, is prevention. And let me be very clear, lifestyle is the very best way to maintain a healthy blood pressure long term, specifically for those who have primary or essential hypertension, which simply means that you have hypertension or high blood pressure not due to an underlying disease. And most people have primary or essential hypertension. So in these cases, lifestyle is the very best. The problem is, if we're realistic, these lifestyle changes do not happen overnight. It takes time to start eating fresh, healthy foods on a regular basis. It takes time to quit smoking and limit our alcohol intake. It takes time to start and continue a consistent, regular exercise regimen. It takes time to learn how to manage or eliminate the stressors in our life. So while we are transitioning into this healthy lifestyle, it is not safe for us to be walking around with blood pressures at 160, 170, over 90, over 100. We are slowly killing ourselves. So these medications serve as a protection until we have the established routine and lifestyle changes in place to maintain a healthy blood pressure on our own. So back to amlodipine. If you do develop any side effects, let your doctor know immediately. It should not compromise your quality of life. There are things that your doctor can do. Have you experienced any of these side effects that we talked about? If you have, I'm curious to know which ones. Let me know in the comments below. And what was the outcome? Did you stay on the medication? Did they go away? Did your doctor do something about it?